There are many different types of diseases of the brain, the central nervous system. The diseases that people are very familiar with, such as Alzheimer's and Parkinson's, are diseases of the nerve cell, the cell that is connected to the nerve fiber. And top of the list of those diseases is a disease called multiple sclerosis.
So when someone is suffering from a progressive degenerative neurological disorder, their activities of daily living become very complicated. Somebody suffering with MS or Parkinson's, instead of a 20-minute trip going to the store, this could turn into several hours. Therefore, it reduces their time to do anything else, including work.
So imagine that this bit of copper piping is a nerve fiber in the brain, and it's the nerve fibers that connect to one another which create this fantastically complex system that is the human brain. And they're allowed to work efficiently because they're covered in a structure called the myelin sheath, which is rather akin to this bit of lagging that I'm going to put around the copper pipe. So that's pretty much what a nerve fiber really looks like in the brain. It's covered in a myelin sheath, and that myelin sheath is made by a cell called the oligodendrocyte. So what happens in multiple sclerosis is that the immune system, which we've developed over many millennia for combating infections such as bacteria and viruses, and attacks the oligodendrocyte and destroys it, and as a result the myelin sheath comes off the nerve fiber, and the nerve fiber doesn't function properly.
So a lot of these people that are suffering from these diseases are not able to hold a regular job. They never know when they wake up in the morning how they're going to feel.
So in multiple sclerosis, the oligodendrocyte is killed and destroyed, and the myelin sheath comes off, and that has very severe consequences for the way that the brain functions. And it also means that the nerve fiber loses its protective covering, and the nerve fiber can then degenerate. So that's one of the reasons that people with MS eventually enter what is called a progressive phase, where they get worse and worse, and that's because they're losing nerve fibers. There are already a number of small-scale clinical trials using drugs or medicines to promote regeneration of multiple sclerosis. So we're in the foothills of that process, but I think the next 10 years is going to see a dramatic expansion in those sorts of trials.